Reauthorization of PEPFAR means that PEPFAR will continue as a program for another 5 years in the U.S. government. It doesn't allocate any funding to the program, but it secures it as a budget item. It also signals to the 60-plus countries that we partner with through PEPFAR that we're in this fight with you, that we're not going to leave, and that we're going to finish what we started. And it also signals to other donor countries that the U.S. will continue to lead on global health and the HIV/AIDS response, but we expect others to join us in this fight. And lastly, PEPFAR is an area that shows the world that we're still a compassionate nation. We have a lot to celebrate with PEPFAR. We've had over 17 million people living full and healthy lives to the support they receive from PEPFAR, and there's a million more HIV infections that have been averted through the prevention efforts that PEPFAR provides. But there's some areas where we still have a lot of work to do, and we shouldn't be remiss about them. One is the youth population. In Africa, 60% of the youth are under the age of 25. This represents a huge potential for Africa, but it can also represent a threat to the gains that have been made toward HIV. HIV incidence is rising in the youth population in Africa. So that demographic needs to be appropriately engaged to ensure that we keep HIV/AIDS at bay. Another area is cervical cancer. Women living with HIV/AIDS are 5 times more likely to develop cervical cancer. PEPFAR has built this great platform on which other health services can be provided. And the Bush Institute is partnering with PEPFAR and UNAIDS through the Partnership to End AIDS and Cervical Cancer to make sure that women living with HIV are receiving the screening and treatment they need to address cervical cancer and make sure they don't succumb to that disease as well.